Hi, everyone. Welcome to Being Patient Perspectives. I'm Deborah Kahn, founder of Being Patient. Our Being Patient perspective segment gives us the opportunity to look at the first person perspective of what it's like to live with a neurodegenerative condition. And today we thought we would focus on brain injury, people who have had repeated concussions and are experiencing cognitive difficulties due to those concussions. So joining us today is Chris Boyce. He joins us from Florida. He's a former hockey player. He played for 28 years, suffered multiple concussions, and is living today with cognitive difficulties. Chris, thanks so much for joining us.
Thanks for having me.
So let's just start first with your hockey career. Longtime hockey player. I'm sure you had many blows to the head. Is that right?
Yeah, I started in 12th grade. Back then, we really didn't talk about concussions. Basically, we got hit, we got back up. That was the mentality. You didn't want to let your team down.
So you started in high school and you continued to play for quite a while. When was the turning point for you? And did you relate it right away to the fact that you were an athlete who had suffered multiple concussions?
Well, yeah, like I was telling you, in 2007, I had 2 concussions within basically a week of each other. First one, I hit a guy head on head, going full speed. I hit the ground automatically. I had pain in the back of my head, my spine. I got up, I saw stars, and really didn't think too much of it after that. I continued the game, trying to be a tough guy. The following week, I played again. This time I hit a player shoulder on shoulder. Same head pain, back pain. I hit the ground, but this time it was a little bit different. I felt different. So at that point, I got myself to the emergency room where they told me I had a concussion.
So when you say I felt different, you were someone who was used to getting hit in the head, it sounds like, many times. And like you said, there wasn't any concussion protocol back then. So you just get right back up and continue playing. When you said that time it felt differently, what do you mean by that exactly?
It just didn't quite feel like me. I really noticed it the following morning when I woke up. I woke up, I felt like a new person, and I had constant, I got tendonitis. I still have it to this day. It's 24 hours a day. So I felt different. I didn't feel like Chris anymore,
So you went to the emergency room, presumably, and they did a scan. What happened, and what did you find out?
They did MRIs, and they said nothing was wrong. Then from there, I went from doctor to doctor to doctor, doing cognitive tests, more MRIs, and everyone was always saying we probably had brain damage, but we couldn't see anything. And it wasn't until I think 2009 or 2013 when we had the DTI MRI, and that showed I had the axonal shear injury.
What does that mean exactly?
It's your axon. Basically, the way I interpret it, your wiring got sheared. Yeah.
So you got hit in the head so hard. Does it impact one specific part of the brain, like the frontal cortex, or is it just basically your whole brain?
Yeah, I'm not quite sure. It's in the superior frontal lobe on mine, so I'm not. It just says white matter loss, 2 microhemorrhages, and, so I'm not quite sure exactly.
So from the time you first went to the emergency room till they picked up something on a special MRI, that was years? Is that right?
Yeah. 2009, 2013, it was really frustrating, going from doctor to doctor to doctor and just getting, you probably have brain injury.
And so presumably you stopped playing hockey then. Was that the last time?
I think I took off about 6 months and continued playing because I just loved it so much. And I think I played up until maybe about 2014, and my anger issues and the sensory overload started getting worse. And I realized I can't be on the ice with these anger issues. So
So when you speak about anger issues, was that the first sign that something was wrong? It's like anger and sensory overload. It wasn't memory per se. Was it more mood swings?
The mood swings, the memory at work. I mean, I was constantly losing things at work, getting hurt, falling off ladders. My doctors had me on so many medications. I was getting in car accidents. It was just, they were just piling me medications. At one point I was on probably about 11 different medications.
So it's been over a decade now since you've been living with this condition. Is it a neurodegenerative condition? Do you feel like you're getting worse, or how do you explain it from your perspective?
I feel like my memory's getting worse. I feel like the personality, the rage issues are getting worse. The paranoia, the out-of-body feelings those are my major problems. I feel like my mind's drifting further away.
When you talk about that outer body experience, we were talking before this live talk, and you were explaining to me that when you go into stores, you get that. Can you tell us what that's like, and what brings it on? What does it feel like to be in a supermarket or a drugstore?
Yeah, the supermarket's a little bit different. It's like I was telling you, the zombie feeling. It feels like you're super drugged up and you're zoning out. You're not aware of anything around you. I'm trying to focus on what I'm going to get, and sometimes it's so bad that you just start grabbing whatever you see in front of you just to get out of the store. And then the out-of-body feelings, that's a little bit different. That's when I start feeling like I'm floating around, like I'm on a cloud. And that can come about just me walking my dogs around the block. And I've noticed it definitely has more to do with sensory than anything. That's what brings it on.
But what do you do about it when that happens? I mean, can you respond to people? Can you talk? What is it like?
The stores, I gotta get out. I'm so scared with the temper that I'm gonna bump into anybody. So I just gotta get out of the situation. When I'm home, for instance, walking the dogs, and I come home and I have that, my new thing has definitely been getting in the garage and working out, and that seems to bring down the out of body feelings. So it's kind of cool. So.
And one of the things I know you wanted to talk to us about is the role of exercise in terms of managing a neurological problem. So tell us a little bit about how you use exercise and what's the impact?
Well, I kind of came on by accident last year when the whole pandemic started. My daughters couldn't be on the swim team anymore, and we needed something for them to do. So we ended up buying exercise equipment, and so I started exercising with them, and I started seeing the benefits with a lot of things. So I've been continuing to do it since then.
So when you say what are the benefits, like what is the benefit? So you work out, and does it help reduce the anxiety, the out of body experiences? Like what is the actual, what is it that you feel with exercise that really helps?
Definitely anxiety. I've been working out a lot since before we started the program today. So that definitely really helped. Depression, it helps with the depression a lot too. It just makes me feel better in the morning. I mean, I don't know how to explain it. I just feel better about myself after I exercise.
So it sounds like on this journey from traumatic brain injury to getting a diagnosis to really coping with it, you've really it sounds like you've had to manage this and figure things out for yourself. Did any of the doctors you went to really kind of give you a playbook of how to manage your condition?
Everybody's just been throwing medications at me. Last week was my final one. I was at 54 medications right now. So
you're on 54 medications.
No, that's how many I've been on since 2007.
Wow, that's a lot.
Yeah, I stopped for 6 months, and last week I said, let me try one more, and it was a no-go. So I'm done with it. I'm sticking with exercise and diet. So.
What types of medication did they put? I mean, it sounds like you have a wide range of them, but were they?
You name it.
Like antidepressants,
antidepressants, antipsychotics, ADHD medications, insomnia medication, just pretty much everything that is thrown at you.
And just to be clear, you've never actually been given a diagnosis of CTE, right? Like many athletes have been.
Yeah.
I mean, the football players all have that diagnosis.
Yeah, suspected CTE. That's pretty much where they got me right now.
Why only suspected? Why is it so difficult for someone who has traumatic brain injury to get that diagnosis?
I guess because there's no test for it, really.
Well, what are they looking for, though? I mean, is it much like Alzheimer's, where if you have plaque in your brain, you know, that's considered a beginning hallmark for the road to dementia? Is it or the tau tangles?
I guess it's the tau tangles, and I know they look at your history. And the problem is all these symptoms can be just a brain injury. So a lot of people look at the symptoms and say, "I have CTE," when in fact you might not. So
yeah. Is it, I'm curious if it's like, you know, some days are better than others. Is it a decline, or is it kind of like, you know, peaks and troughs, like up and down in terms of, you know, how you're coping and your memory and anger, etc.?
It's pretty consistent. You know, come around 2 or 3 o'clock every day, I know I'm going to start going downhill with, you know, with all the out of body and paranoia, and even I get visuals in my mind. It's like, it's not really quite a hallucination, but I can see them so vividly. So, you know, everything starts to really go downhill in the afternoon.
So do you feel like you're kind of someone who's watching someone else inside your own body? Is that a fair way to describe it?
Exactly. Yep. It's like I'm watching myself from the outside. Yep.
And to bring yourself back, you just have to, is it like an episode? So does it come and then last for a little while and then go?
It can last for hours. It can literally last for hours. Going to the beach will get rid of it pretty quick. Floating what was that?
Why going to the beach will get rid of it?
I love the beach, so I guess it's just soothing for me. Floating in the water is something I've learned that really helps me. So next year we plan on getting a pool, so hopefully that's really going to help a lot.
That's, I mean, it's fascinating for me to hear how you describe these symptoms. And I'm just wondering too, how, you know, because this is I mean, we always equate CTE with the football players getting repeated concussions. And now I think we're learning more, but the fact of the matter is someone like yourself who's an athlete can't really get a diagnosis, makes me think that must be really difficult, you know, when you don't have, and you don't really know how to treat it.
Yeah.
So what type of doctors have you been going to?
All neurologists, psychiatrists, therapists. The psychiatrists and therapists they really don't know what to do with me.
Yeah.
Every time I tell them I have these symptoms, they kind of brush it off.
And I can imagine that gets really frustrating.
Yeah.
So, Chris, on this journey, I mean, it's been now over a decade. What is it that you would say to other people? Because obviously you're an exception to the rule in that you're training yourself about how to manage this. But, you know, there's obviously a problem there. It's obviously not going away. So, you know, looking back on all of the doctors you've seen, all of the medication you're taking, is there any insight that you can offer other people who may be experiencing the same thing?
You know, I wish I would have stuck with diet and exercise first. The medications really masked all my symptoms. So, you know, I really didn't understand them until I got off the medication. So now I'm starting to really, you know, dissect what each of them do.
And what diet, like what's worked for you?
I don't have an exact diet, you know, it's just fruits, vegetables, and fish, and some pork. You know, I stay away from all the sugary stuff, and, you know, I still believe in my cheat days, you know.
Everybody needs a cheat day.
Yeah, exactly. There's nothing wrong with that, but I mean, you know, For instance, in the morning, it's just oatmeal and berries and a coffee. In the afternoon, protein shake, maybe a banana, and then at dinner time, we'll have, fish and vegetables. So it's pretty consistent. And I'll eat fruit all day long, so.
Right. And you exercise. Do you tell us a little bit about your exercise routine? What does that look like every day?
Well, this morning I walked on the beach. I actually did more than I normally do. I try to set a goal for a mile. I did 4 miles on the beach this morning.
Wow.
So I kind of combine it with my hobby. I like collecting beach rocks. So, in the process of me walking, I was collecting beach rocks, and then I enjoy fishing. So after that, I went fishing for a while this morning. And after that, I came home and I worked out for about an hour and 45 minutes. So that's what I'm shooting for every day.
Wow. You must have to eat a lot. That's a lot of exercise.
A lot of fruit,
So, and we know with research so far that when you do aerobic exercise for at least half an hour every day, and it sounds like you're getting a lot more, for at least 5 days, if not 7 days a week, we're actually adding gray matter to our hippocampus, the area of our brain that is responsible for memory. But I'm curious about the behavioral aspect, because you describe a lot about the anger issues, and exercise seems to work for you to kind of stabilize. Am I right in assuming that or in saying that?
If I'm home and I'm paying attention to the symptoms, I can get myself in the garage and it's a nice quick fix just to bring myself down.
Yeah, which makes, yet another proof point of the strong connection between exercise and cognition and brain health, for that matter.
You got to pay attention to your symptoms. So that's huge.
So we have a viewer who's asking, how do you motivate yourself to do exercises? I have vascular cognitive impairment, not depressed, but unmotivated.
Yeah, first thing was my daughters. That was my biggest motivation. I wanted to work out with them. Of course, they've left me now, so I'm all by myself with the dogs. But, my other motivation is nothing else is working for me. So, this is really all I have right now. And next summer or the summer after that, I need to get spine surgery. So me doing all this is gonna, make my surgery recovery better. So that's my motivation right there.
Is the spine related to the injuries you had
I'm guessing so. Yeah, I need 2 fusions, and I have disc disease throughout my spine. So I'm guessing.
Yeah. And that viewer said, "What's your pick for this year's Stanley Cup?"
I'm a Devils fan. I can't watch hockey anymore. It bothers me too much. But they're out of the playoffs, so I am actually rooting for Vegas. So that's the Golden Knights. Yeah.
Well, on that, Chris, thank you so much for your time and for your insight. And I'm sure. If people have any questions for you who have suffered traumatic brain injury or CTE, perhaps they can post this in the Facebook thread. I know that you're on Facebook, Chris. So, perhaps if they have the opportunity. And we have another question coming in asking, is there anything different about your relationship with your daughters and wife now? Are you against your kids being involved in contact sports?
I have both my daughters on the swim team. If they wanted to play hockey or any of those sports, I would say absolutely no. There's no way on earth. Yeah.
Yeah, it's amazing how many, I've heard so many former athletes say that, and even the scientists now, the researchers saying no way. The science is now proving that repeated brain injury is really very detrimental to our brain health, as you can testify. So Chris, thank you so much for your time. And if any of our viewers want to contact or have another question, please leave it on the thread on Facebook, and we'll either pass it along to Chris or he can check it himself and respond to you directly. As always, we appreciate the first person perspective. It sounds like you've been through a lot, and we wish you all the best. And yeah, please keep us abreast if you gain any insights of something other than exercise and diet. Sounds like it's working well for you, but anything more would be greatly appreciated.
All right, thank you for having me.
Thank you so much. So if you want to watch more of these interviews, please subscribe to our newsletter at beingpatient.com. You can sign up. We'll let you know what's coming up next. We have 2 series, one with an interview like Chris from the first person perspective of people diagnosed with neurological neurodegeneration of all sorts. And the second is a talk series called Brain Talks, where we interview experts and we ask our experts to take your questions. So for more of those, please sign up for our newsletter on beingpatient.com. Thanks very much for watching.